Imagine choosing public health and being told it's not a real profession. Let's talk about it with guest co-host Dr. Anthony Santella. Hi guys, welcome back to RTs Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everyone. Welcome to anyone new. And today we have a hot topic that we are going to talk about. Actually, we're talking about public health education and how the federal policy change could reshape the public health education and the entire workforce. So, yes, this is what we're talking about here today. But first, let me say thank you to my past guest co host, Tracy Harden, who spoke about community health workers empowering, being crucial to patient empowerment in the asthma self management space. And she really did drop the gems on that episode. So wanted to say thank you to her. But today we have an amazing guest co-host, Dr. Anthony Santella. Yay!
Linda, happy to be
Hi.
here with you.
Hi. Happy
Hi.
to have you. Okay, guys. So I'm going to read Dr. Santella's bio to let you know why I had to have him on the show to talk about this topic. So, okay, so Dr. Anthony Santella is a tenured professor of public health program director, and doctor of public health program director at Fairview University's Egan School of Nursing and Health Studies. With 20 plus years of experience, he has acquired advanced degrees and credentials in the field. He has an MPH from Emory University, a doctorate from Toller University. He's certified in public health. He has his MCHES. He has done research focuses on public health and vulnerable populations such as people with at risk who are with or at risk for HIV and AIDS. He has had multiple peer review articles and presented at national and international conferences, and is also has been on national international media outlets such as Forbes, New York Times, Washington Post, to raise awareness and inform the public about critical public health issues and solutions. He has held various leadership roles in executive committees and has received various awards and honors in public health. He is amazing, and that's why I had to have him to speak on our show here today. Thank you once again, Dr. Santella.
Thank you, Linda. It's a pleasure to be here with you. And I'm going to embarrass you just for a moment before you continue and say, when I think back in the last, almost 20 years of teaching public health students, when I think of the ones who rose to the top for me, Linda's name always comes up, and she knows that because we keep in touch pretty regularly. I'm super proud of everything she has and will continue to do to advance the field of respiratory therapy and public health.
Oh, thank you so much. Well, you see, guys, he's also my professor. He got me into public health. So that's why, yeah, we both here in this space. So this topic, okay, let's just get right into it. Uh, Dr. Santella, so before we go anywhere else, can you break down in plain language what the Federal Department of Education reclassification decision actually is? Like, let us
Yeah.
know, what does that mean?
Yeah. So what happened was under what's called or what's nicknamed the One Big Beautiful Act, the Department of Education is required to reclassify post-bachelor programs, so graduate programs, whether they're master's or doctoral, into
Mhm.
one of two categories, either professional degrees or graduate non-professional degrees. And that will determine how much federal student loan debt a student can take. And their
Mm,
argument, they meaning the federal government, the argument they make is there's too much borrowing and it's putting people at a disadvantage. And so there is some truth to that. I
right.
won't argue
Yeah.
that. And so their definition, which is a proposed rule, there's still a
Mm,
lot of advocacy
right.
happening, and
Yeah.
I've been part of that, and I encourage everyone watching and listening to
Yeah.
this to kind of use your voice in a way that you're comfortable with. So the proposed rule uses this definition that to be a professional program, it should lead to licensure
Okay.
and involve at least 6 years post high school. So that generally
Okay.
means, 4 years of college and then at least 2 years of post college.
Right.
And usually at the doctoral level. And so the fields that they've determined as professional include medicine, both MD and DO programs,
Mm-hmm.
dentistry, law, pharmacy, veterinary, optometry, podiatry, chiropractor, clinical psychology, and theology.
Mm-hmm.
Those are their definition. And so students in those general doctorally prepared licensed programs can borrow up to, in this proposed rule, borrow up
Mm-hmm.
to $50,000 a year with a
Okay.
limit of $200,000
Okay.
versus the second group, those graduate non-professional, I use that in air quotes because I don't
Right.
believe that,
Okay.
non-professional programs then would be limited to 20,500, so less than half per
Okay.
year, and a cap or a limit of 100,000, which is half, right? 200,000 versus 100,000. And so when you think about, and you and I have briefly spoken about this, all those other programs that are usually licensed, but not always,
Right.
like nursing, both master's and doctoral nursing programs, or
Mm-hmm.
social work, where you have bachelor's, master's, doctoral, public health, where you have bachelor's,
That's just
master's,
massive.
doctoral. Now,
Yeah.
public health is not a licensed profession, so we
Right.
have
Right.
that to our disadvantage there. But also the allied health professions, if you think
Yeah.
about PT, OT,
Mm-hmm.
speech, audiology, things like that. There's
Yeah.
lots that are licensed professions
Mm-hmm.
that you do need to have a doctoral degree per accreditation requirements, or even just being in some cases competitive in a very saturated market, in a saturated work environment.
Yeah.
So that's the two categories. Those are the basic definitions. But what does it mean? So
Mm.
it means generally, I say three or four things.
Okay.
One is probably first and foremost, reduced access to federal borrowing.
The funds. Yeah.
Right. So now, assuming this happens, and I think there will be change by
Mm-hmm.
next year, that students who are entering master's or doctoral programs that are graduate non-professional
Mm-hmm.
will have only half of the borrowing capacity, 100,000 limit, versus those other professional programs.
Professionals. Yeah.
And so when you think about especially the doctoral prepared programs, I think about like DPT, physical therapy, OTD, occupational therapy,
Right.
um, even DSW, doctor in social work, nursing, DMP, especially private institutions, right? There's going to be a mismatch there. And that's going to force essentially a lot of universities to think very hard about which programs they're offering, how
Yeah.
much aid they can provide, and how they're setting tuition. So there could be some good that comes out of something like this, where maybe there's some right sizing of tuition.
Okay.
Um, so the first major implication is reduced access to federal borrowing.
Okay.
My personal opinion is if you're in a grad program, you're an adult. So you have to make a decision about what's a
Right.
priority for you, how
Correct.
much you're willing to borrow, how much you're willing to go into debt. That's on you.
Yeah. The
I, as a federal
individual.
government, shouldn't have to force that on you, tell you.
Right. Yeah.
That's my own personal opinion. The second implication is elimination, supposedly July 1st of next year, of what's called grad plus loans, which are generally the way most grad students get uh, financial aid.
Okay.
And so what that will mean is there will be when that comes away, when the federal government decides to step away from giving out money in terms
Mm.
of financial aid, it means people, grad students, will have to turn to private loans, which generally have higher interest rates, institutional aid, meaning like scholarships and things that an actual college or university can offer,
Okay.
or finding other kinds of out-of-pocket payments. Most of these private loans that are generally going to be the default option for most people have high interest rates and
Right.
fewer protections for us as consumers.
Yeah.
And that is worrisome to me. And then the third implication, which concerns me the most, and you hinted at this earlier, is the impact on workforce pipelines,
Yes.
right? Especially in high need professions. I don't have
Yes.
to tell you or anyone who's listening or watching this that we are an aging society. As
Okay.
people age, live longer, want
Yes.
better quality of life, we're
Yes.
going to we, meaning I include myself in that bucket, are going
Mm-hmm.
to have to rely more on these
The,
non-professional
yes.
grad programs to keep us safe, healthy, productive members of society,
Yes. Scary.
which is very scary. And then the last implication, which I also think a lot about as someone who works at a university, a private university that is tuition driven,
Mm,
is how not just but universities and colleges will respond to this.
yeah.
Because for some people, for some institutions, I think they're going to have to reimagine their tuition structure. For others, they may pull out of offering certain programs because
I
there just might not be
know.
interest without loans. And so I worry about my sector too, just because selfishly that's where, I'm
Yeah.
employed.
Right.
So you've heard a lot probably of different professional organizations and student groups and people who care about these sorts of things being
Mm.
very loud with their
Yes.
voices, and I
Definitely.
appreciate that.
Yeah.
And I think we just have to kind of keep fighting the good fight until we
Absolutely.
see change.
Absolutely. I totally agree. And I think, and thank you for breaking it down like that because I think in social media where we're seeing a lot of this, I think they're like, the media is kind of saying like, if you have these degrees, like they don't mean anything or they're going to be taken away. So I think there's a lot of confusion with what
There is.
folks are seeing.
Yeah, yeah, I wholeheartedly agree. And to me, part of this issue that I wish the Department of Education, the federal government would have thought about a little more thoughtfully is
Mhm.
the PR aspect of this.
Yes.
Because, I see even a lot of teacher groups saying, oh, now teachers aren't professionals anymore. What does
I-
that mean for caring for your kids? There'll always be professional programs. I don't
right.
care who says what. What this boils down to, and this is really the way the government should have framed this issue, is that if I was the federal government, Department of Education, this was a priority for me, I would say something like, because we care for you as professionals and don't want people paying astronomical tuitions where they go in debt, sometimes for the rest of their working lives,
Right.
we're going to put in things into motion that are really going to force the hand of colleges and universities to reimagine their tuition so that people don't have to go and borrow hundreds of thousands of dollars to better their lives and their careers. But what they did instead is, frame this as a professional versus non-professional program.
Right.
And now everyone's jumped all over that.
Oh, correct. What we're seeing on social media, it's hilarious, some of it,
Yeah.
because even with the nurses, there are TikToks where nurses are like, well, if I'm not professional, then I'm not coming to work. And
Yeah.
it's
Yeah, there's
chaos.
definitely a lot of criticisms and uncertainties with this. I will add, though, that this is still a proposal.
Correct.
And
Very
so
fresh.
keep fighting the good fight because the louder we
Mhm.
are, the more they're going to hear. Write to your members of Congress, write to your
Mhm.
leaders in your professional organizations. So there's still a consideration period, we'll say.
Mhm.
I would bet a lot of, if I was a betting person, I would bet a lot of money that this will change a little bit before it becomes final. The other thing that I believe is sure, at least I've read as part of kind of just keeping up with this, is that there's expected to be a what they'll call a grandfathering period
Okay.
where people like for I think up to 3 years, so
Okay.
that people in school now or getting ready to start school, let's say the next academic year,
Okay.
it'll be if
A
you're already in
grace
the
period.
program, you'll have a grace period before it
Okay.
kind of kicks in. So
Okay.
um, I guess that's
Yeah.
better than nothing.
Yes.
But like I said, the government's misstep, in my humble opinion, is that they should have framed that as we want to prevent irresponsible borrowing
Yeah.
because especially young people don't always think about finances and
Oh,
interest rates and
right, right,
payback
right,
and
right. Definitely.
loan forgiveness and things like that. But there was a much better way of
Way
doing
to
it
do it.
than just delivering it like this.
Absolutely. I even I'm around like let's say my god kids who, friends are in the nursing program, and I remember even hearing her, she's in school now and she was freaking out because she did not understand what that meant, and
Yeah.
thinking that her degree would be like toilet paper
Yeah.
or something. And
Yeah.
I'm like,
I mean that
no.
that and that's unfortunately the what's happening is that
Yeah.
people what they're reading in between the lines is that the
Hmm.
federal government is undermining
Right. What we
the
do.
professions.
Correct.
And so that's a tough thing to hear and tough thing
Yes.
to accept because it's simply not true, right?
Yes.
I don't care if you're a nurse, a social worker, a doctor,
Right.
a public health worker,
Right.
we are professionals.
Yes.
And so
Absolutely.
like I said, part of this unfortunately has become misinformation,
Yes.
disinformation, bad PR,
Yes.
and um, and that's just unfortunate given just the chaos that's already happening with the federal government.
Yes, and I'm one of those people because as the asthma lady doing all of this, like my mission is to fight continuously asthma disparities. I wouldn't be where I am today without my public
Yeah,
health background. In additional to
yeah,
my respiratory therapy skills and knowledge. So I too was very confused when I heard this. I don't watch the news like that. So when I heard it, I was like, wait a minute. It was very, very concerning. And that's why I definitely wanted to talk about these topics. And just having an episode, like I said, prior to this one, where we were talking about community health workers and, the collaborations of all of these entities are very important when it comes to public health. Even with COVID that we experienced, So definitely taken aback by
yeah.
this
It's and
news.
it's like I said, it's one of those things where bad delivery on the side of the federal government. Even community health workers, that's a good example, right? That's generally you're considering folks who maybe don't have a lot of
Have a
formal
lot,
education, have a high school
correct.
degree, maybe sometimes an associate's degree, even sometimes
Yes.
bachelor's, depends on context and setting. But
Yes.
to me, of course, they are two professionals.
Professionals.
You don't need to have a doctoral degree to be considered a
Right.
professional. I
Right.
think, I mean, hindsight's always 2020, and I certainly want no part in these kind of shenanigans here. But
Mm-hmm.
if someone asked me what my opinion was on how to do this differently, you come up with a definition, say degree
Mm-hmm.
programs that require a doctoral degree, that require licensure, that require more time post-college,
Mm-hmm.
yes, should have probably higher borrowing limits because those are longer
Right.
programs and you
More
want to
time
give
in
people
school.
choice and agency in the decisions they make for their education.
Right.
Um, no one should be borrowing $200,000 for a master's degree, for example,
Right.
right? Um, so I get it. You want to prevent irresponsible lending and borrowing and kind of help right size that,
Mm-hmm.
but this was not the way to do it.
Yeah. Absolutely. I agree. All right, Dr. Santella, with everything you have done in this field, in the public health space, walk us through what pulled you in to the field of public health and ultimately leading you into academia.
Yeah. So I wish there were undergraduate public health programs in the 90s when I was in college. There weren't. I fumbled around college partly because of my own just probably irresponsible behaviors and, you know, also like people in their late teens, early 20s, like, do they really know what they want to do for their career?
No,
Mostly
you
not. So I
stumbled.
knew I was interested in science. I started first as biology and then
Okay.
science education because I thought maybe being a high school biology
Science
teacher was
teacher.
in my future.
Okay.
And then I was like, well, I don't want to be stuck with just an education degree because what if I decide one day I don't want to be a teacher? Maybe I should do
Right.
something more practical or vocational. And
Okay.
so I went to like med lab sciences.
Got you.
So I fumbled around college. I I wanted the degree. I got the degree,
Yeah.
but my senior year, final semester of college, I had room for electives, and I took both a community health class and a health administration class that were both taught
Okay.
by physical therapists who really lived and breathed public health, even though they didn't
Okay.
identify as public health professionals. And the
Right.
second I took those classes, I said, this is
This
what I
is
want to
it.
do. I could
Got
care less about the microscope or drawing someone's blood or whatever. I want to
right.
do this. Now, of course, I
Right.
was like weeks away from graduating, so that wasn't very helpful.
Oh. Oh, okay.
Um, so I graduated college. I went and worked in the pharmaceutical industry for a few years, and then
Okay.
applied to go to graduate school for public health, and did both my master's and doctoral degree in public health, and
Oh,
uh, got kind of hooked in the HIV sexual health space
okay.
for two reasons. One, I'm just fascinated with people's health
Health
behaviors and why we
behaviors.
make choices we do and
Me
how
too.
health policy and health behavior intersects with each other.
Yeah.
So I ended up doing health policy as my area, but I could have easily done health behavior because I'm just fascinated by both those areas. I was
Hmm.
interested in HIV because it was, as a young
Right. The
person in the
90s.
90s,
Hmm.
a very big part
Everywhere.
of my life, both just
Yeah.
as a someone interested in health and helping people, but also as a gay person, having a lot of
Hmm.
friends and knowing people who have died from HIV and AIDS. It's
Yeah.
always been part of my life, whether I've chosen it or not.
Right. Right.
Um, so I've always been committed to that. I also feel probably a lot like you that there's something probably part of our DNA that just makes us helpers.
Right.
And
This is
I don't think you can't always develop that. That's just part of who
yeah.
you
It's
are or
just
not.
I
And I can
know.
appreciate different styles of people and different strengths that we all have. But I've always been someone who wants to help people,
Yeah.
sometimes to my own detriment, but
I know.
I do that.
You
And so
tired.
I went to work after I finished my doctoral degree, I went to work for the New York City Health Department, which is the largest local health department in the
Yes.
world,
Yes.
almost 7,000 people. And I enjoyed it, but I knew and I felt it very, it filled my cup. I found it very
Hmm.
fulfilling. However, I realized pretty quickly that governmental work was not for me. I
Yes.
know, I know myself and my strengths and weaknesses enough to know that just the way government space tends to confine people in certain roles and
Right.
it just that wasn't for me. I enjoyed
Yeah.
it. I admire people who are
Who could do
lifelong
it?
civil servants and do
Hmm.
that. I
Absolutely.
really tip my hat to them, but it wasn't for me. I was always interested in teaching. Remember, I thought I was going to be a high school science teacher when I started
Right. Right.
college. And so for 2 years, I was an adjunct. I spent 3 semesters doing undergrad, 3 semesters doing grad at different schools in New York City. And then I said, you know what, I like this because I can help people learn about public health. I can keep my fingers and toes in public health through like consulting work and research
Right.
projects and affiliations. And it gave me a lot of flexibility and freedom to be
Hmm.
myself and to pursue things that I found important in public health. And that
Excellent.
was in 2009 when I
Right.
started working at LIU, which is where I
Right.
met
Right.
Linda. And that was, 17 years ago now or whatever. So,
Dang, 17? Is it?
so that was a long time ago. And,
That
and
was a lot.
I've mostly spent that in graduate education, working
Yes.
with people both at master's level and now at doctoral level. And there was no looking back.
Yeah. I mean, I can't believe it was that long
I
ago
know.
that we met each other. My
Yes.
God. I remember the first email I sent you when I was like, can you tell me what public health is?" Like
And
exactly.
and I also remember pretty fondly that Linda had a exceptional mentor and Dr. Ellen
Becker.
Becker,
I was just with
who
her.
who is someone, even though we don't really stay in touch, I think
Mm-hmm.
about periodically because she is someone who is a clinician, but
Mm-hmm.
understood public health to a degree
Yes.
that was able to kind of see that spark in you, that, kind of
Mm.
blending and melding those worlds of clinical and public health, and was a really nice introduction to our program. So,
Yeah, I love it. And I'm just like you, like love to help. And I really, and people have asked me which one do I love more, like clinical, being in a hospital or the public health space. And I'm just like, it's too different. Like I love both, but
yeah, yeah.
I'm enjoying right now more the public health space, I think more. So it's just kind of my thing. Okay, well, I want to say you did speak about the impact on students and training. But so what do you think are going to be the ripple effects of what we discussed as far as the reclassification? And you kind of touched upon it a
Yeah,
little
yeah.
bit,
So
but
we have to see how this will land.
okay.
Nothing is supposed to go into effect until middle of 2026.
Okay.
Um, and so I'll be clear, I do think there is room for change and reform when it comes to loans, interest rates, borrowing, lending. I see it. I was someone who took out a lot of loans to pursue graduate
And still
school.
paying. Me too.
So I get it. I get that people have goals. Sometimes those goals come at small costs, sometimes they come at big
Big
costs.
costs. Mhm.
And we as adults have to kind of weigh those, risks and reward that come with getting on our career path and lending and borrowing. So I think the way to fix this is twofold. One is take many steps back with this whole definition of professional, non-professional.
Yes,
That's
sir.
because that's what people are, hanging on to,
Focus
and
on,
that's
yeah,
really not at the core of the issue here. The
correct.
issue is about borrowing and lending,
Yeah.
not about is a teacher
The
or a public health
titles,
worker
correct.
a professional or not.
Yeah.
So they need to just backtrack that and say, "Oops, we shouldn't have done that," kind of thing.
Mm-hmm.
And that's a pretty easy fix
Fix.
that will go a long way to somewhat re-earning trust. And then secondly, I think colleges and universities, whether they're 2-year, 4-year, public, private, really need to work with the Department of Education on right sizing tuition expectations.
Okay.
Because as you could just do a quick Google search and just look for any program, whether let's say masters in nursing,
Right.
and you'll find a
A
wide
list.
range of
Mm-hmm.
what people charge.
Mm-hmm.
And I'm not sure I agree with that fundamentally because the degree is a degree. Now, you might get a few bells and whistles more at one place, less another place, this, that, and the other
Right.
thing. But ultimately, what you're leaving with
Is
is
the
the same
degree.
degree.
Right.
Let's just take a master's degree in nursing. Should there be, and I'm making these numbers up for sake of
Mm-hmm.
example, should you be able to get that for $25,000 and $250,000?
Right.
Probably not. That just
Yeah.
doesn't make sense to me. So there are bigger fundamental conversations that need to be had. That's not going to be resolved in the next 9 months.
Right.
So, I think maybe there's a compromise here where, for example, maybe there's some limits,
Mm-hmm.
uh, but that should apply. That shouldn't be split between professional and non-professional because they all are professional programs.
Yes, sir.
Maybe there's a difference. There should be differences between like public and private and
Right.
caps. Because if federal government established caps, then you can't charge more than whatever the cap is for the degree. But those are much longer term conversations, and I even hesitate to say it because the Trump administration wants to dissolve the Department of Education and
Right.
really reassign the work of
Restructure.
the
Yeah.
DOE to the Department of State, Department of Labor, Department of Health and Human Services. So who's really going to be in charge of this if there even
Right.
isn't a Department of Education?
Yeah.
So I just,
It's a
it's
lot of
just,
abstract. Yeah,
yeah,
it's not.
I'm not sure.
Yes. Yeah, yeah, yeah. But I thank you for sharing your insights on that. And with that being said, what do you think about the future of public health? Like what do you think we should do now to protect,
Yeah.
the fields that we're in?
Yes, I have one suggestion, really. I mean, I have lots, but for sake of time, I'm going to keep it to one big one.
Hmm.
And I think it's hurting us a lot, even with what all we've talked about today. And that is licensure. We are not a licensed profession, so we're not a regulated profession like social work, respiratory therapy,
Right.
OT, PT, speech,
Preach.
really every other
Hmm.
health profession, or
Yeah.
most other health professions. And because we're not licensed, we, uh, I'd say, can't make the same arguments that the nurses and the social workers and the
Right, right.
PTOT folks can make. And so I'd like to see the public health profession move to a space where there are licensure
Licensures.
requirements. So, for
Hmm.
example, like the CPH, Certified in Public Health exam, I'm just using that as an example, doesn't have to be
Right,
that,
right.
is intended for people who graduate largely from MPH programs, master's level, since that is, even though you can work with a bachelor's degree in public health, most jobs today, just given where all the health professions are going, do require a master's degree.
Masters. Hmm.
That's a requirement to work.
Yeah, yeah.
And then maybe we'll do a better job because of that in being reimbursed for services, just like other health professionals. And
Right.
so I think it's a win-win all the way around, and it'll force more consistency in the way public health programs are run to
Okay.
ensure that people can pass the certification
Achieve.
exam.
Right, right, right. No, I agree. I definitely I love this space. So I love the public health space. And like you said, we're all, yeah, God willing, will be aging. And we need to continue to encourage the youth or whoever to be in this field. We need it. And I think COVID was a great example of that. So I don't want anything that will deter people away from this profession. And
And listen, COVID might have been the most recent pandemic that people alive today have experienced, but it certainly
but
won't be the
it's
last.
not. Hello.
Yeah.
We know, yeah. Okay. And me being a respiratory therapist, definitely even something like RSV being that was only for babies and now adults have it. It's so we're all these things we're just seeing and it's like yes, and those that are underserved definitely these things really do affect their quality of life. So
Sure do. Yeah.
it's yes, guys. So thank you so much, Dr. Santella, for
Always.
speaking and coming on the RT Share Tea podcast. We appreciate you. Thank you for clarifying what's going on in the public health space and what's going on with the federal government. Guys, thank you so much for listening. I hope you learned something here today. And for those of you that are in the public health space, you hear myself and Dr. Santella speaking on this topic. Please advocate, speak up. We love this field and we need your voice. All right, guys. So please, please, please join us. Continue these conversations. RT Share Tea is on most podcast platforms on Wednesdays, except for when I'm on vacation. And we are on YouTube on Thursdays. So much more to come, and we are growing. together. All right, guys. I'll see you next time.